We have our last presentation of the day, which is on physical therapy treatment for PSP and CBD. And we have two fine doctors of physical therapy from UCSF. We have Dien and Lucy Lotz here. And we're just so glad to have UCSF participating today, and glad to have Lucy and Alex talking about the physical therapy for these two diseases. Thank you.
Great, thank you for having us. Again, I want to thank Stanford for allowing UCSF to participate in this. I think this is a really important day for everyone involved, and I'm really glad that this is happening. I think I have a lot of patients who don't have this sort of community, so I'm really grateful that this is available. Again, you can call me Lucy Lotz. I participate in I'm assistant clinical professor in the program at UCSF, and I see patients with any type of neurological diagnosis, which includes PSP and CBD, and Alex is also a PT in the UCSF program. Before we get started, this is a little outline of what we're going to quickly run through, but I know it's been a long day, and I know we can be a little bit sleepy in the warm weather after that big meal. So I want to start with just taking a couple big deep breaths, and if you can, lift your arms up overhead, really fill up your lungs, and then exhale everything out through your mouth. Another one in through your nose, filling up your belly. You can kind of twist side to side if that feels good. And then let it all out. Okay, great. So as a lot of people probably know, physical therapy involves movement. And for us to get a doctorate of physical therapy, we went to graduate school for 3 years, and some of us actually then continued to study after school to become a specialist. So Alex and I are neurologic specialists, so we took a board exam, which digs a little bit deeper into different diagnoses, the pathophysiology of these diagnoses, and the evidence behind these diagnoses. So I often find that some patients go along their kind of spectrum of the diagnosis, and they go on through life not really knowing that physical therapy can actually be really beneficial for a lot of different reasons. I know earlier today we were talking through different cognitive challenges, different speaking challenges, breathing challenges, dizziness challenges, imbalance and falls, and everything that can kind of be involved in a neurologic diagnosis. And you might be surprised that physical therapy can actually also be supportive with a lot of those limitations. Similar to what was being said earlier and the importance of multidisciplinary care, there are multiple different rehabs and different people within a team that can be helpful, including PT, OT, and speech therapy. And a lot of patients ask, what is the difference and why am I having to see all these different people? For the general rule of thumb, this PT can help with more of the mobility side of things. That can be as simple as getting you from point A to point B, from the bedroom to the bathroom. That can help you getting back on the pickleball court. That can help you find a wheelchair that is most comfortable and most meaningful for you. OTs can help with more of the cognitive things once you're in those settings, whether it be in the bathroom, in the bedroom, while you're with friends, while you're at work, making things more functional for you. And then speech therapy, like we heard earlier, for speech and swallowing. So knowing again that there's a lot of different things going on in your life, and we're here to kind of support you along the way. So stemming into a little bit more why physical therapy can be helpful, you can kind of think about it in different realms. Early in the diagnosis, we like to try to jump in as quickly as we can to really prevent things like falls in this image. As things might progress, we can be there on your team to help compensate for things, to continue to maximize your potential and maximize what you're doing in your day-to-day life. And I think what multiple people have said today in terms of the importance of finding joy in your day-to-day life and finding meaning in your day-to-day life, and how we can be supportive in improving that right now, but also preserving that in the long term. So when you come to see a physical therapist, every physical therapist has their own exam that they like to go through, but there is a basic assessment and exam that we all like to get our baseline information, especially as you start to build a relationship with a physical therapist. We like to get all of our data in different stages and at different timelines, but it usually involves an assessment of strength, balance, your walking. We might have you do some things that test your strength and test your balance. A lot of our standardized tests have good evidence behind them and research that shows that specific cutoff points put you at either higher risk for falls or might predict some outcomes in the future. So being able to collaborate with you and talk with you about what numbers you might be falling at right now can be helpful in preparing for the future and planning a good plan of care for you and exercises that might be supportive for you. So why physical therapy for these diagnoses that we're talking about today? In general, everyone needs exercise. Everyone loses strength as we age, unfortunately. If there was a pill that we could give you to maximize your cardiovascular health and your strength, I wish we could do that. But unfortunately, we all need to be exercising every day. Once you see a physical therapist once, we're not going to solve all your problems. It's something that has to be continuous, but also it has to be achievable and realistic and fun for you to actually be doing it for the rest of your life. So we have really in-depth conversations with you about, again, what's important, what brings you joy, and what specific things you might be challenging you right now, and how we can help support that. But then also maybe adding in a little bit of that difficulty in order to maximize your aerobic and muscle strength. Okay, but specifically in PSP and CBD, we find that patients often present with the early falls as well as postural instability. Some traits that we might try to address are the stiffness, maybe a widened gait, this extension that we see in both the trunk and the legs that has a tendency of causing some of the falls. Also difficulty with turning, maybe a little bit of shuffling, freezing in doorways, and just overall bradykinesia, or that slowness in your movement. So depending on what you're presenting with, not every treatment is going to be the same for everyone, but we really hone in on reducing the number of falls, improving your balance standing in place, as well as your balance when you're moving through space. We want to help you walk and really maximize your aerobic capacity through movement, as well as your functional mobility to interact with your family, interact with your life, and really continue to do the things that you enjoy. This could involve finding an assistive device that works best for you to really minimize falls, and also to allow you to continue to participate in your day-to-day life. Some specific things that we address, again, with the slowness and stiffness. There's a lot of research that shows taking the brain out of the calculation in general by using an external focus. So sometimes people describe a disconnect between their brain and their body, their legs not moving the way their brain is telling it to move. And so we have found that there's a lot of techniques that we can try to implement early, so these things are learned and can be helpful throughout the diagnosis. And those are external cues. So sometimes you might have a PT turn on a metronome and have you walk to the metronome. So it's making you move at a faster speed than your legs want to go, or that your brain is telling you to go. Walking to music, walking on lines can be helpful. So sometimes we have patients who either get stuck on turns or start to shuffle in the kitchen. We have given some patients taped lines that are about like a foot apart, so they have a cue for them to put their foot down on. So specific cues like that can be helpful, as well as setting up a really good stretching program. Again, if things start to progress, we can teach family members how to do these with you as well. But kind of coming back to this diagnosis again, I think as things get more challenging, we really want to maximize function in what you're doing in your day-to-day life. making sure that you're doing things that are meaningful for you, not because you've seen them on TV and you heard that they is something that you should be doing, but something that you'll be able to kind of continue with and really work into your day-to-day routine. So one model that Alex is going to touch into a little bit more is something called the dental model. And I think that is something I hit at on day one with a lot of my patients in order to address the importance of having us on your team at multiple episodes. So again, rather than seeing us once, giving you an exercise program and sending you on your way as if you broke your elbow, we like to think about it as being on your team for a good chunk of maybe right now, but if things change, allowing you to have us be there, your support for new equipment, or if your balance seems to be getting a little bit more challenging, setting up a timeline where every 6 months to a year, you can have a check-in. We can do those standardized assessments, like I mentioned earlier, talk about what things might have changed, and we can kind of help you as things go along.
Hi all. So for the next part, I'm going to be talking about things a little bit more generally, because with, as Lucy said, exercise is something that we all need and can benefit from. And when we're thinking about a good exercise regimen, these are basically the 4 things that we want to emphasize and that we try to encourage all people to think about if they are going to be trying a regular exercise regimen. So the cool part about this next couple of present slides is that some of these things that I'm going to talk with you all about are things you can potentially do at home right now, maybe even right after this session that we're all done with. What I'm saying is go exercise. But cardiovascular exercise and endurance, basically, you have to make sure that you have the energy, the capacity to get from point to point, whether that is walking across parks, whether that's going to a amusement park with your family, whether that's even just getting up from the bed and going to the restroom. We all need some level of cardiovascular capacity to do that. For resistance training, this is basically just strength. Are you strong enough to do the things you need to do? Managing stairs in the home, getting off of a toilet, being able to do a 5K, if that's what one of your goals is and that's what you're working on still. Ultimately, whatever your level of function, there's an amount of strength that a person needs to manage. And our job is to figure out what are the gaps there that we can help you build on. Task specific is basically doing things that relate to real life. So I'm assuming many of you have been to a neurologist. How many of you have been told to stand like this or walk like this? When do you ever do this in real life? It's important to assess your balance, but it's not really something that typically translates into everyday practice. So what we really care about is, can you bend over and pick something up? Can you step down a curb? Are you able to step up curbs, manage stairs? If you are going to trip over something, do you have the appropriate protective response to keep you from doing that? Now, there are occasions when that tandem walking heel to toe is important, and it gives us a more global picture of your balance as a whole, but it's not necessarily specific to a task that we're looking for. And I kind of went into that with balance already, but you need your balance to stay upright or even to sit in a chair. So balance is, of course, something that we have to consider when we are planning out things. So with that in mind, something pretty straightforward that everyone can do with family, with friends, is go on a walk. You don't have to worry about the distance or the time, because just like Lucy said, it's about having fun and being able to enjoy yourself when you're out there. So for those of you who are walking ambulatory, going out with friends, this helps to train your, this is task specific as well as working on balance. I should have checked more cardiovascular as well, depending on how far you go. But this is something that can easily be implemented. There are some considerations that we do think about within physical therapy, such as if your environment isn't conducive to your ability to walk, whether there are a lot of hills, whether it is unsafe in the area, then there are secondary ways to try to work in that cardiovascular process. But for those of you who can get out and walk around with folks, it is a very easy way to start that process of getting in that training. And the best part is you get plenty of sunshine like you have today. We live up in San Francisco, so we don't get this very often. And ultimately, you have the social support of being with others, because more important than anything else is the relationships you have with the people around you. And if you can find ways to enjoy that together, then that is really what we're looking for. Now, let's say that someone's just been hospitalized coming home and they're having a little bit more difficulty walking, but they were walking before. Well, then in that case, just walking around the home is something that can be appropriately challenging. So this doesn't have to mean that, well, to put it another way, you will feel like a hamster going back and forth. There's only so much space within a home you can walk. Unless you have a nice lawn, then invite others over too, so they can walk there. But this type of training here that we can have people do is basically just getting them up and moving, getting them to move around the home as much as they can and finding a safe way to do it. So there may be equipment needs, which Lucy had talked about, that we can help identify with physical therapy. You may need secondary support from somebody else to help you going. But I want to emphasize that there is value in practicing to walk, even if you're not regularly walking around. Because just as with everything that we do training-wise, we want to make it harder, but not frustrating in the training process. If it is something that you can do and always are doing at a regular basis, it doesn't necessarily help you to go a little bit further, to work on the cardiovascular aspect or to work on the strength within your body. So we want to challenge you when you're training. In everyday life, of course, the easiest way to do something, the way that spends the least amount of energy and effort, is absolutely the way to go. But when you're training, we always like to encourage you to try to push yourself a little bit more. For those of you who have access to weights, this is, of course, one of the easier ways to start doing weight training, resistance training. There are things you can do at home, which I'll go over a few things afterwards. But if you have access to the gym and you have the machines, you can't really do them wrong. What I mean by that is they're locked for their movement. So unless you're trying to go 300 pounds on some of the weights, but you're going to find an appropriate amount that is, again, challenging, but that you're capable of doing, that's really the number we're looking for. And of course, with any of these types of trainings, we don't want to do it so that the exercise is the emphasis of your day. Really, it's a supplement. You may be a little bit more tired today, but the hope is that as you continue that process, that you have enough strength to then do the things that is valuable for you in your everyday life. Functional training. So this is very task specific. And this can be something such as getting up from a chair, practicing with or without your arms. This can be potentially practicing getting up from a floor to make sure that if you do lose your balance, that you're capable of getting up by yourself. This could be scooting forward and backwards in your wheelchair or in your regular chair at home. This could be practicing rolling over in bed, doing bridges so that people can help you to dress if needed. Functional training covers the gamut in terms of what you need to do in everyday life. And really the process is finding the right dosage or the right modification to the exercise so that we can make it appropriately challenging for you. Since ultimately, if you can do it in everyday life, that's great, but we want to make sure that you can keep being able to do it. And that if there's some type of variation, such as if for whatever reason you're on regular cotton sheets and then you switch out to satin sheets, it's going to be a little harder to maintain that same grip on the floor or on the bed. Tai Chi, for those of you who like a lot of slow breathing, controlled movements, this works really well for coordination, again, the social aspect of this, and in practicing movements together, since you're trying to maintain a specific rhythm. So there's a little bit of inhibition that's required so that you're slowing down the breathing, you're focusing on your movements as a whole. And there are variations where it can be done in sitting or in standing. So it doesn't have to be that the practice is done exactly in one way. And for those of you who are familiar, boxing or rock steady boxing, this works on power, this works on your balance, this works on your cardiovascular endurance. Since ultimately, hopefully you're not going to have to punch anybody, but it does at least give you the chance to work on that flexibility in your chest and your shoulders. It does get you to pivot and turn, which is something that we do in everyday life. It gets you to have to work on dodging, thinking, dual tasking, where you're focused on one task and then they switch it up on you at another time. So a lot of things can be done. And here's one that, does anyone here like dancing? I don't know why I'm raising my hand, I don't. 2 left feet. But even dancing, even something as fun as putting on a song, dancing with someone else, dancing by yourself, dancing like no one's watching, that can add value in and of itself to work on your balance, as well as, depending on how long you go, your cardiovascular endurance. So what I mean to say by all these things is there's lots of opportunities to exercise. The physical therapist that you work with can help you come up with more specific guidelines on what you should be doing, the dosing recommendations, etc. But what I was hoping to show you with all of this is basically there's a lot of different ways. Anything can be exercised if you push yourself. Anything and everything. And it's all about finding out where you are and trying to see what else can I do at this point? How much more can I potentially work toward? Since you take any person who doesn't move, doesn't matter how far along they are in life, doesn't matter what conditions they have, but if they don't move, they're going to get weaker. That's just a fact. They're going to have more difficulty getting around. And we want to make sure that we can either slow that process down or even improve you from where you are if possible. So again, start wherever you are. Motion's lotion. Get moving as much as you can. This can be done by, before getting out of bed, stretching, rolling around a little bit, taking your partner's side of the bed so that you can claim dominance over that. It can be that you are working on sit-to-stands when between episodes of Netflix or TV or Bridgerton. It can be that you're walking around the home, that after you use the restroom, you just kind of circle around a little bit. It can be that you are, again, standing while using the microwave, brushing your teeth, standing instead when you're brushing your teeth if you can, tug of war with your dog and sitting, or again, if they stole your sock, and playing beanbag toss with kids, or not. You can just throw beanbags around the house. That's up to you. And getting a little bit more advanced, these are some general recommendations that we have for group classes that y'all can consider. Feel free to take a picture or write it down. I'll stay on here for a little bit longer. But there's a lot of opportunities that don't even have to necessarily be paid for. Yes, there are organizations and there are things that people can pay for that are a little bit more specific, but Always Active, for instance, is a program for older adults, and it's online. I think it used to be in person prior to COVID, but now they switched entirely to online, where there's a community of people that all have difficulties with balance and they come together. So it may not be PSP CBD specific, but there are those opportunities for folks to then join in and just participate in whatever ways that they feel capable. There's a sitting and a standing class, as I believe as well. Otherwise, it's important to keep in mind how active you are. So whether that's how often during the day you're up, you can measure that with stepping trackers, you can measure that with health apps on your phone, you can measure that just basically by timing yourself on how often am I really getting up in the day. Because when you start to look at the numbers, just like when we start counting calories, it doesn't always add up the way we like it. And lastly, dental model. To go a little further into this, as Lucy had started off, within physical therapy, we want to work with you where you are when you first come to us. We're identifying what things you're having troubles with. We're identifying the resources that you have, the barriers that are present, and then ultimately how to try to address those as best as we can or utilize those facilitators that you have working for you. And there is a set amount of time, though, unfortunately, that we can work with. Now, there is the value that we can continue ongoing therapy, but to a certain point, there's only so much we can do in terms of maximizing a person's independence. At that point, then it becomes more maintenance therapy, or in this case, the dental model, where there are check-ins that we have every so often to make sure that things are still going well at that level. But every bout you do have with us, we're working towards specific goals. I want to be able to walk further. I want to be able to get out of my chair by myself. I want to be able to manage the stairs in my home so I don't have to be afraid of going outside. Those are the things that we're identifying with you, and then we're trying to figure out how do we do that. After addressing those goals and helping you to improve that mobility, then it starts to simmer down, and there aren't exactly things that we can work on in those moments. but things do come up and support is needed. This is not a process that just stops after you finish with physical therapy, but really it's a way for us to check in with you and make sure things are going the way that you're hoping that they are. So ultimately, in that dental model, we want to make sure that we can support you still. We want to make sure that we're kind of along with you along the path and the progression as it turns out, or celebrating with you when things are going well and that you're still able to do things. So we don't need to have all those regular check-ins. And just like the dental program, exercise can be tedious just as brushing your teeth. And really our goal is to help you help yourself as much as we can. Yes, there's a lot we can do with you with a 1 hour, 2 hours a week that we're in session, but we want to teach you those habits, and we want to help you all learn what you can do at home, because you're with yourself, you're with your family, you're with your caregivers much more often than you're going to be with us. And the real change happens when we can start to identify those habits and then make improvements as much as you can. So really, how I like to liken it is we give you an instruction manual, and we do kind of show you through the instruction manual, but it's up to y'all to figure out with us to guide you. How do I start doing this? So make a plan. I don't know why there are question marks here. Find a program that works for you. Get outside help to continue your program after PT, whether that's one of those exercise classes I showed y'all, whether that's just going out on walks, or whether that's some of the things that we taught you in PT that you can continue doing at home. And every so often, following up your finish time with us, you can check back in 6 months, 3 months, a month. Really, it kind of depends on how quickly things are progressing. It does depend on how capable you are after we're finished at that time. And it depends on if there's any significant changes as well, such as if there's been a hospitalization or if there's been a fall. And we're very happy to have y'all come back. And yeah, and to make adjustments to the exercises, to provide recommendations for equipment, amongst other things. Oh, sorry, the last thing. When you're looking for somebody, like Lucy had said at the beginning, with a specialization, since different physical therapists have different levels of training, you can go to choosept.com and look up neurologic specialists around your area. And that's a very easy way to tell that somebody has the potential knowledge and experience to work with folks. That's not to say people without the specialization can't, but that is to say that those with the specialization are more likely able to know, so you don't have to sift through people and not really understand if they might or might not have experience with this. So it just raises the bar a little bit when you do look for folks in that way. All right, and that's all. Thank you.
Thank you, Alex and Lucy. Okay, we have a lot of questions. I think this probably relates to the dental hygiene model, but somebody asks, what is the optimal amount of maintenance therapy?
So I think everything with physical therapy is gonna start with it depends, because it depends on where you are at with your journey of exercise, where you're at with your mobility, and what your specific goals are. So I think if you come to a physical therapist who knows you and you already have a set exercise plan, it might be a quick session or two to check in on how those things are going and how we might adjust specific exercises or adjust specific devices. If you're new to the exercise journey, it might be a few sessions. I personally see patients for about a 2 to 3 month period, every week to every other week, just to make sure that we're finding what really works for you, and we're starting to build a really strong foundation so you feel comfortable when we do send you on your way, and you feel comfortable with the toolkit that we're providing you.
Okay, have you seen many hamstring problems in PSP or CBD?
Yes.
Okay, any recommendations for what people can do if they're seeing hamstring problems?
Again, depending on where the issue is present, is it because of a strain since they lifted too much or doing something? Is it because they're stiff? Is it because it's hard for them to know how to activate that muscle, and they're kind of co-contracting that hamstring with other muscle segments. Really, it comes down to the exam to figure out what the issue is that the person's having with the hamstrings, and then from there, addressing it. So to put it a little bit more simply, if it's stiff, stretch it. If it's strained, rest it. If it's weak or if it's co-contracting, then learning how to isolate that muscle so that you can use it as much as you need to.
Okay. Could you talk a little bit about, because the mobility problems in PSP and CBD are progressive, can you talk a little bit about whether or not PT will help in the long term? And related to that, should one ever give up?
So obviously we're physical therapists and we wouldn't have a job if we didn't believe in it. But I do think it's important to state that we did mention before and earlier into the day that exercise is neuroprotective, and there is research that shows that it can slow the motor symptoms and it can slow the motor progressions. So I do find that it's very important to maintain and keep at it. And I think having us on your team to support you along the way to really maximize what you're able to do every step of the way is really important. And having a cheerleader is also really important because we believe joy is what gets us through our day to day, and we can kind of help you find that in your life.
Okay, kind of as a follow-on to that, somebody asks about if somebody is wheelchair bound, what kinds of exercises can be done?
And I wanted to add one more point to what Lucy was talking about earlier to the prior question before the wheelchair question. But where was I going with this? As you progress, there's still that question of what do you find valuable in life? Is it that you want to be able to go outside with your family? We can help figure out ways to do that with the appropriate equipment. Do you want to be able to spend time watching TV in a couch that may not be the most comfortable, but you need to be able to sit to do so? We can absolutely help with that. So in the end, there's a lot to consider, but we always focus it on what the person's goals are. And in terms of wheelchair exercises, something that people can do include wheelchair push-ups, where holding onto the armrest, they're just pushing down, try to lift their butt up. It can be forward, backward scooting so that you can work on getting weight off of your ischial-tubercles so that you're not putting too much pressure that can put a person at risk of pressure injuries. It can be that you're practicing leans to stretch side to side. It can be that you're working on butt lifts so that you can help with getting up out of a chair position, especially if you're in a lower surface from the wheelchair or sitting on a commode or a toilet. It can be that you're marching in place. It can be that you're kicking. It could be that you're doing rock steady boxing things. There's so many things that we can consider, and it really just depends on what you like doing and what the person's goals are.
Okay, and a little further along, if someone can no longer voluntarily move, are there some passive exercises that could be done?
Yeah, so passive exercises for the chair. But I was going to say too, I think a big part of what we find is caregiver training. And I know someone earlier was saying the stress and burden that is being a caregiver and also training a caregiver. And we can be a support in all of that. That can come with teaching you how to stretch your family member. It can be a matter of teaching you how to transfer your family member. If you don't have a Sarah Steady, if you're looking into getting a Sarah Steady, we can kind of problem solve ways of helping the patient get in and out of their chair, getting in and out of bed safely so you're protecting your own back. Last thing we want is for the caregiver to also need physical therapy. And so I think really seeing the patient and also the family and the caregiver as one unit so we can best support them. I think very gentle range of motion exercises to support if they're getting Botox. We can teach ways that we can help maximize the Botox that was received, really minimizing pressure sores, like Alex was saying, in the wheelchair, talking about positioning and working with vendors to make sure that you're getting the right chair that works for you. Because I think a lot of times patients become very overwhelmed when a chair is the route that you're going, and helping you find what is appropriate for you can be a really big step. So we can also be supportive in that realm as well.
Okay, someone asks, there's some questions here about insurance. Could you talk about whether insurance, like Medicare, pays for physical therapy, and what happens when you run out of your usual 8-week prescription for PT and you're now being denied additional PT? What can you do to protest that?
Yeah, so whenever it comes to receiving care, there needs to be some type of medical necessity wherein it's determined by the referring physician or care provider, as well as with the evaluating physical therapist. And that's to maintain an active episode of care. In terms of the dental model, you don't necessarily, like, my understanding of this is that as long as a person has a progressive disease, there's been legislature passed that allows them to come back and at least be assessed, if not to continue an active episode of care. So it may be that in the case where it's denied, it may be for continuous therapy, but not necessarily for assessment and recommendations, since that's my understanding of it for Medicare. And I've never been in a situation for myself that I haven't allowed somebody to come back. Seems a little preposterous.
Okay, yeah, we agree. Denise, how are we on time? Well, we have to wrap up. Okay. All right. Let's see. Let me see if I can find, yes, there is a GMO settlement. We'll try to get people information about that. There's a question about leaning. A lot of people with PSP or CBD lean in a chair. What can you do to make people comfortable who are leaning?
Yeah, I mean, I think depending on how severe the lean is, if you're in a wheelchair too, I would think about pillow posturing. I think sometimes if we can find a way to separate your body with either the armrest or the edge of the chair that you're on to get you a little bit more into midline. I think from what I've done would be pillow support, but then also if patients also have a pretty significant neck lean or a neck tilt or really bad cervical alignment, sometimes we've given patients soft collars to give their neck a little bit of support so they're able to be a little bit more in line. But then too, if it becomes so severe that sometimes something like a tilt in space chair, which I think someone mentioned earlier, can be helpful for positioning using gravity to help.
Okay, Alex, Lucy, thank you very much. That was wonderful.